How the poor survive in America? Have you ever thought about how millions of people in the world's richest country fight every day to stay alive? What problems do they have to deal with, and how do they get around a system that seems to be against them? Although everyone is promised opportunity by the American dream, millions of Americans live in a very different reality. In America, poverty is a complicated and enduring problem that causes many people to struggle to achieve their most basic requirements, including housing, food, healthcare, education. For individuals who are below the poverty line, living in the richest nation in the world can be a daily struggle due to the soaring cost of living in many cities and stagnant income. The American poverty landscape. In 2022, the U.S. Census Bureau reported that over 37 million individuals were impoverished. This number has only increased as a result of inflation and unstable economic conditions. People of all colors, genders, and backgrounds are impacted by poverty, yet certain communities are more severely affected than others. Poverty disproportionately affects Black and Hispanic Americans, single moms, and people without a high school education. In 2024, the federal poverty level for a family of 4 is projected to be approximately $30,000 per year. However, the genuine cost of living in many regions of the nation is far higher. Rent in major cities like New York, San Francisco, and Los Angeles is so low that it hardly even pays for transportation, food, and medical care. Millions of Americans are consequently perpetually in a state of financial instability, frequently just one unforeseen expense away from catastrophe. Housing, the cornerstone of consistency. Finding and keeping secure housing is one of the most important problems facing Americans with low incomes. For many years, the cost of housing in the U.S. has risen faster than wages, making affordable housing an unattainable goal for many. Rent is defined by the federal government as no more than 30% of an individual's income. Yet for many low-wage workers, rent takes up half or more of their monthly income. Many impoverished Americans are compelled to live in cramped, subpar housing or with several roommates in order to make ends meet in cities where housing demand outpaces supply of available residences. Not everyone is as fortunate as others. Over 500,000 Americans are estimated to be homeless on any given night by the U.S. Department of Housing and Urban Development, HUD, with many more living on the verge of homelessness. Even for those who do have a place to live, the standard of living is frequently subpar. In low-income areas, subpar housing conditions such as mold, malfunctioning appliances, and inadequate heat are typical. Tenants often risk being evicted, sometimes for quite minor offenses or for falling just a few days behind on their rent. Families become even more unstable as a result of these eviction cycles, which push them into shelters or onto the streets. The function of public aid. Public assistance programs like food stamps, SNAP, Medicaid, and housing vouchers are vital lifelines for a large number of low-income Americans. Despite being vilified frequently, these programs help millions of families cover the necessities of living by offering them crucial support. Nevertheless, it can be difficult to navigate the intricate network of public assistance programs, and the advantages they offer are frequently insufficient. One of the biggest food assistance programs in the United States, SNAP assists low-income individuals and families with their grocery shopping. Even though SNAP benefits are essential, most beneficiaries must rely on food banks or skip meals in order to make ends meet because they usually cannot purchase enough food for a whole month. Another essential service is Medicaid, the government-funded health insurance program for those with low incomes. Millions of Americans would not be able to afford health care without it. But Medicaid frequently isn't able to pay for specialty care or prescription drugs, so some people can't get the care they require. By paying a percentage of rent directly to landlords, housing vouchers awarded through programs such as Section 8 assist low-income families in affording rent. Sadly, there is a considerably greater need for housing help than there is availability. Even after waiting years for a voucher, many families may have trouble finding a landlord who will accept it. These programs are necessary, but they are far from ideal. Numerous people who require assistance either don't receive it at all or don't receive enough because of stringent qualifying standards, drawn-out application procedures, and inadequate money. Food insecurity, a lifelong challenge. For millions of Americans, hunger is a reality that is both invisible and constant. According to USDA estimates, 10.5% of American households experienced food insecurity in 2021, which is defined as not having regular access to adequate food for a healthy, active life. Food insecurity in low-income households frequently entails skipping meals, purchasing inexpensive, unhealthy food, or depending on food pantries. Although they are important tools for people experiencing food poverty, food banks and pantries are not a permanent fix. Food banks offer varying quantities and quality of food, and some families are unwilling to use them because of stigma or embarrassment. Furthermore, a lot of low-income communities are food deserts, places where it is difficult and costly to find fresh, wholesome food, pushing locals to rely on processed or fast food. The effects of food insecurity on health are significant. Chronic illnesses like diabetes and heart disease, which disproportionately impact low-income populations and be brought on by poor nutrition. People become trapped in a vicious cycle of poverty and ill health as a result of these health issues, which further makes it difficult for them to work or take care of their children. Healthcare, an expensive need. In the United States, medical expenses are infamously high even for individuals with health insurance. The expense of medical treatment can be very burdensome for Americans with low incomes. Medicaid and other programs help a certain amount, but many low-income Americans are stuck in a coverage gap, or they make too much money to be eligible for Medicaid, but not enough to buy private insurance. Many people in low-income groups put off or refuse medical treatment, even for serious problems, because they cannot afford it. Many times, preventive care is unaffordable, which might eventually result in more serious health issues. Trips to the emergency department have become the standard for medical care. Nevertheless, the exorbitant expense of these trips can result in crippling medical debt. One of the main reasons people file for bankruptcy in the U.S. is medical debt, which disproportionately impacts low-income households. Even with insurance, one's out-of-pocket costs for copays, deductibles, and prescriptions can mount up rapidly. Rent and food expenses frequently take precedence over healthcare costs for a large number of impoverished Americans. The gig economy, a two-sided blade. For some Americans with low incomes, the advent of the gig economy has meant new income prospects, but it has also meant new obstacles. Gig employment gives workers flexibility by letting them establish their own hours and take on several tasks. Examples of gig work include driving for Uber, delivering food for DoorDash, and freelancing. Gig employment can be a lifesaver for people who are unable to dedicate themselves to typical 9-to-5 occupations because of childcare obligations or health concerns. But gig labor is often erratic. Demand-driven earnings fluctuations are common, and gig workers are not eligible for benefits like health insurance, paid time off, or retirement savings because they are considered independent contractors. It is challenging for gig workers to achieve long-term financial security because there is no safety net. Moreover, when including in costs like patrol, auto insurance, and maintenance, gig labor frequently pays less than minimum wage. Many gig workers must work long hours in order to make ends meet, leaving little time for leisure, spending time with family, or going back to school or getting training that could lead to higher-paying positions. Education, a way out of deprivation. Many low-income Americans believe education is the best way out of poverty, yet the system may be difficult. Public schools in low-income areas often lack resources and supplies to provide a quality education. Thus, a cycle reduces low-income children's earning potential by reducing their high school and college graduation rates. Higher education, once considered as a path to success, is becoming harder for low-income students to finance. Due to escalating college tuition from recent decades, financial help often falls short of covering the whole cost of enrollment. Work and family obligations force many low-income students to take on considerable college debt, and they may struggle to graduate. Graduates don't necessarily get higher compensation. High school degrees are often enough for low-paying employment, and even college graduates may work at companies that don't cover their student loan obligations. Innovative techniques for surviving. Despite their challenges, low-income Americans are inventive. They employ various methods to live on less. Impoverished Americans use meal planning, couponing, bartering, and pooling resources with friends and family to survive in a system that often seems against them. Some people work in the informal sector, cleaning, babysitting, or selling online. Some use community networks to pay bills with family or neighbors. Many low-income persons facing medical emergencies, eviction, or other problems use crowdsourcing platforms like GoFundMe as their last resort. The function of charities and nonprofits. Nonprofits and charities assist low-income Americans survive in addition to government subsidies. These agencies provide food, shelter, legal assistance, and employment training. The Salvation Army, Feeding America, and Habitat for Humanity are among the many nonprofits fighting poverty. But relying on charity isn't sustainable. These institutions provide crucial services. Support staff are often underpaid and overworked. Charity cannot alleviate poverty's causes: lack of healthcare, education, low wages, and expensive housing. Being poor in America requires resilience, creativity, and the ability to work within a system that doesn't always care about the most vulnerable. Even though millions of Americans survive on government assistance, freelance labor, and community support, too many are not getting enough help. Growing safety nets won't solve American poverty. Structural restructuring is needed. Affordable housing, raising the minimum wage, improving healthcare, and providing high-quality education may help millions overcome poverty. The impoverished will continue to survive in a nation that offers opportunity to all except a select few, often against all odds. If you found this eye-opening, don't forget to subscribe and hit the notification bell. Stay tuned for more in-depth discussions on important issues and join us as we continue to explore the stories that matter most.